Hi, and welcome to our seminar, Secrets to Better Balance. I'm Steve Rapasali of Performance Physical Therapy. If you're watching this seminar, you probably have some issues and concerns about your balance. Hey, I'm telling no secrets here that most of us over 40 are going to start having issues with our balance. And I want to tell you that you are probably ahead of the crowd if you're concerned about it enough to want to watch this seminar and learn the secrets to how to improve your balance. In this seminar, I'm going to show you some really simple tips on how to test your own balance, to find out exactly what balance is and how we measure it, some factors that go into how your balance can be affected, and finally, I'm going to give you the opportunity to reach out to us and to find out exactly what is going on with your balance and how we can help you. But even before we get to that, let's start with some basics. Number one, why is balance so darn important? I'm going to try to be real simple about this concept. People who fall and can't right themselves injure themselves. And when you injure yourself, you have a tendency to either break something or to experience some sort of catastrophic injury that can lead to your untimely death. Wow, now, isn't that a nice way to start the seminar with that bundle of good news? But the vast majority of people who die over the age of 80, they die of falling. If we can eliminate your vulnerability to falling, we will improve your longevity. We will improve your health span and your lifespan. So this subject is super important. Not just for people that are over 80, I'm talking about for anybody over the age of 40. Now, maybe you're like me, and maybe you notice that when the lights are dim and it's late at night, you have to kind of watch yourself and you're worried about walking down the stairs without holding on to the handrail. You notice that when you're in a crowded street, you're watching people and you're, making sure that something is close by. You're not as confident when you're going up and down stairs that don't have handrails, or if the stairs are really steep. You're noticing that when you get out of a chair, it's taking maybe a little bit more concentration and effort to get out of that chair, and maybe you waver a little bit. You might notice that when you turn your head, you start to go backwards a little bit. If that's you, this seminar is for you. So I want to begin by talking about some definitions related to balance. One is center of gravity, and two is base of support. Simply put, when your center of gravity is within your base of support, you're balanced. When your center of gravity is outside of your base of support, you are unbalanced. So I'm going to use this handy red ball that you can all see to indicate where your center of gravity is, how it changes in relation to your base of support, and then how you're unbalanced versus balanced. So this red ball is about where your center of gravity is, except it's about 2 inches inside of you. So your center of gravity is about where your belly button is, but it's inside of you. Your base of support is simply all the parts of you that are on the ground at any one time. So if my feet are wide apart, I have a wide base of support, and I'm pretty stable. If I have my feet together, I have a narrow base of support. And that means that I have diminished balance. If I stand on one leg, I have a tiny base of support. And you can tell that I'm really unbalanced. If my center of gravity goes outside of my base of support, I fall over. If I keep my center of gravity within my base of support, I'm steady, right? So center of gravity, base of support. If I lean over, my center of gravity goes outside of my base of support, I fall over. So balance is a combination of your ability to maintain your balance, in other words, keeping your center of gravity within your base of support, and your ability to right yourself. Meaning that if I find myself going off kilter, can I right myself? Can I bring myself up to center? Or is it like when you cut a tree and it's timber, it goes over to the side, right? So maintaining your balance and righting reactions, two factors in safe balance. Now, like it or not, there's a lot of age-related declines associated with balance, and there's just no way around it. That's just how it is. What are some of those age-related declines? Well, number one is vision. We often don't see as well as we get older. Our acuity goes down, our ability to focus goes down. And some of us even have to wear bifocals. And if you wear bifocals, there's that little line in between those two prescriptions that is kind of like a no man's land. If you've ever had to walk downstairs while wearing bifocals, you know that that's kind of funky because you're really not sure where that stair is. That is an age-related visual risk to your balance. Muscle power. We have a tendency to lose about 1% of our muscle mass every year over the age of 40 if we don't do something about it, right? So if you don't do anything, you get weaker as you age. And for those of us who lived through the coronavirus pandemic, you know that you're sitting around not doing as much as you normally would do, and you feel deconditioned and you feel less strong, and that's actually true. Proprioception changes with age. What the heck is proprioception? Proprioception is your ability to know where your joints are at any given time in space. So for example, if I were to close my eyes, I know that my elbow is bent because there's little receptors in my elbow that tell my brain that my elbow is bent, and now it's straight. With time and with no practice, those sensors give less and less feedback to your brain, so you kind of sort of don't know where your joints are in space, meaning ankles, knees, hips, etc., etc. So those are factors that can affect your balance. Also, footwear. So here's the part of the seminar where I get to nag you a little bit about your footwear. So the proper footwear makes a lot of difference in how your balance is. Simply put, if you wear heels, if you have worn out shoes, if you have shoes that are ill-fitting, if you don't keep your shoes in shape, sometimes soft-soled shoes have a bad effect on balance because it's like walking on pillows and you can't feel where your feet are on the floor. So for a lot of our patients and clients, we recommend that they think about switching to leather-soled shoes so they can feel the floor better. So sometimes all those cushiony shoes are not good for your balance because you don't really know where your ankle and your foot is in space, and you can twist your ankle that way. Medications. Some medications will affect your balance, whether it's high blood pressure medicine, diabetic medicine, heart medication. And again, it's beyond the point of this seminar to go through each medicine that you could possibly take and the effect that it has on balance. But just note that if you're taking more than 2 medications, that can have an effect on your balance, and be aware of it. Also, when you take them has an effect on it, right? So there can be times in the day when you're more at risk depending on the medication that you take, and you need to be aware of that. Other medical problems. Diabetes. That's something that can affect the not only the small blood vessels in your extremities, but also the nerves, and it can affect how you feel. Neuropathies, they can also affect your balance, and you have to be aware of that. The light and the environment has a huge effect on your balance. Nighttime, as I like to say, is crazy time, right? The lights are low, you have to go to the bathroom in the middle of the night, you kind of get out of bed, you can't see very well, you don't even have your glasses on, you're going to the bathroom, and you wind up falling. You trip over something you didn't see. So low light environments can be dangerous for balance. And the environment in general. You know, let's face it. You know, cleanliness is next to balancedness. I just made that word up. But if you have a lot of clutter around the house, particularly throw rugs, high pile carpet, things on the stairs, those are opportunities for disaster to happen. So you have to critically examine your environment to try to minimize the opportunities for you to get yourself into trouble and to lose your balance. So, how the heck can we test our balance? Well, there's a lot of different balance tests out there. I'm going to show you just 3 of them very simply that you can do at home. No special equipment needed other than maybe a tape measure, maybe a chair. So let's go through 3 of them now. The one-legged standing balance test, the sit-to-stand test, and the standing reach test. You don't need to take notes, but you can. I'm going to go through each one with the help of my well-bodied assistant, Matt, and he's going to be my model. So the one-legged standing balance. So for this test, you just need you. And all you're going to do is you're going to stand on one leg. Now there's a couple rules. So number 1, Matt is going to cross his arms across his chest. It doesn't matter what leg Matt starts with, but he's going to stand on one leg. The other leg, he can't wrap his leg around the other leg. He can't put his toe on the floor, and he can't do the Hopi Indian dance, as I like to call it, so he can't hop around. From there, you're just going to time how long you can do that without a lot of swaying, putting your hands down, holding onto the wall, putting your foot down. That's the one-legged standing balance test. So, young people like Matt here should be able to do that easily for 30 seconds. Anybody over 40 should be in the 25-second range. The good news is anybody 70 to 80 years old, if you can do this for 6 seconds, we consider that pretty darn good. So it does decline what the normal is as you age. So that's the one-legged standing balance test. The next test that I want to talk about is the sit-to-stand test. Now, for this test, all we need is a chair without arms. If you don't have a chair that doesn't have arms, just don't use the arms. So, put the chair in a safe spot. Matt's going to sit in the chair. Matt is going to, again, cross his arms in front because we don't want to use his hands, right? And Matt is going to stand up, and Matt is going to sit down. Now, if you can't get up without using your hands, you failed the test, right? And that's an indication that you need some significant help. We are going to count. We're going to do this 2 ways. We're going to count how many times he can do this in 30 seconds. And the count starts when he gets up, and 1 is when his butt hits the chair. So that was 1, and he's going to go up and down. So we'll just say, go, start the clock. And we're going to start counting 1, 2, 3, 4. We're going to do that for 30 seconds. At the end of 30 seconds, we're going to take account of that. You should do, if you're under 40, about 25 of those in 30 seconds. As you get old, that goes down a little bit more until the point where if you're in your 70s and 80s, you should be able to do about 13 of these in 30 seconds. There's another way that you can count this, and that is how long will it take you to do 5 repetitions. So it's the same rules. Your arms are crossed. You're going to go up and down 5 times, and you're going to start a watch. Go. 1, 2, 3, 4, 5, and then stop the watch. And what is that time? If you're young and healthy like Matt, you should be able to do this in under 10 seconds. Anything over 13 seconds, and that indicates that you might have a problem. That is the sit-to-stand test. And then the final test that I want to show you is the standing reach test. So we're going to move this chair away, and Matt's going to stand against the wall. It really doesn't matter where he stands, and he is going to raise his arm that's closest to the wall and make a fist. And this measurement is going to start where his knuckles are. So in this case, it's right about here. Now, without moving his feet, we're going to ask Matt to reach forward and push his hand forward against the wall, right? As far as he can go without losing his balance. That distance, we are then going to measure, right? As you can imagine, The younger you are, the longer you should be able to forward reach without losing your balance. And for young people, it's well into the 15, 16 inches. And as you get older, it drops down. And in your 80s, 6 inches is considered normal. So, thank you, Matt. So if you do any of these 3 tests, and again, there's more tests that we usually do in the clinic, but if you take a combination of those 3 tests and you come up less than what the normal or what the average is, that's an indication to you that you have a higher risk of falling, and you should get professional help with that, right? So these tests can either use to make you feel good about yourself or to push you on and say, hey, I got some issues, I better take care of this. Now, how can you improve your balance? So we've gone over what balance is. We've talked about the factors that go into balance. We talked about how to test your balance. We talked about if you're at risk. Let's talk about how can we improve our balance. Now, a note here. I do not know you yet, so I don't know exactly what your problem is. I'm giving general recommendations, but over 30 years of treating patients, I can tell you some common things that we've seen and some things that I want to share with you. They may be super helpful. They may not apply to you, so just take it with a grain of salt. So with that said, the number one thing that I want you to start doing beginning today to improve your balance is something that you already do every day, hopefully twice a day, and that is brush your teeth. I want you to brush your teeth twice a day. Now, not because I'm concerned about your dental health, even though I am, but I want you to use toothbrushing as an exercise for your balance, because you may forget to do these exercises, but you're probably not going to forget to do something like brushing your teeth because you've been doing it twice a day for your whole life. So what do I mean by this? Well, here you are in your bathroom, you're in the mirror, you're looking at yourself, and you're going to brush your teeth. Only the difference is you're now going to brush your teeth standing on one foot, right? And you're going to brush your uppers standing on one leg, and then you're going to brush your lowers standing on the other leg. Doesn't matter which one is upper and lower, it really doesn't matter. But the reason I like doing it when you brush your teeth is because you have the vanity there so you can hold on if you need to, right? So if you're like me, you know, you're wobbling a little bit, you can use the safety of your vanity to hold on. Number 2, you have the visual feedback of your mirror, so you can see what your body is doing and how it's compensating. And that is a method of feedback for yourself. So if you see yourself all of a sudden lurching, but you can see it, but maybe you can't feel it as well, at least you know, uh-oh, I'm tipping over. So go ahead and try that, right? So that's the first thing that I want you to do. Brush your teeth, standing on one foot. Number 2, I want to talk about some common factors that go into, as you age, why you can be vulnerable to loss of balance. Now this one you're not gonna understand initially, but I want to explain it to you. And that is, many times we find our patients who have balance problems have tight ankles. They have stiff ankles. Their ankles are not flexible. So I want you to do an experiment, a couple experiments. Number 1, I want you to go back against the wall, and I want you to lean against it, and I want your feet away from the wall, but I want you against the wall. And I want you to pull yourself away from the wall without using your hands. And let's see how I do that, if you can go down to my feet. So what I do is when I pull myself away from the wall, I wind up pulling up with my toes, and that brings me forward. So it makes sense that if you don't have the ability, the flexibility to lift your toes off the ground, that you will have a tendency to lose your balance backwards. Here's another way to test if you have tight ankles. And I'm going to ask Matt to come in again, and we're going to pan down to the floor. Matt's going to sit in this chair. Here is an easy ankle flexibility test that you can perform at home. So you're sitting in the chair, and it's got a nice straight back to it. Matt is sitting all the way back in there. He's got his butt all the way back. His back is fully contacted with the back of the chair, right? His hips and his knees are kind of sort of about at 90 degrees, and his feet are flat on the floor. Feet flat on the floor. Ankles are, again, about 90 degrees. So this point of the test, he's not going to move his feet. In other words, he's not going to bring his foot forward or backward. He's not going to move it around. He's going to keep it planted. And from here, he's going to grab either side of the chair, and he's going to scooch his butt forward all the way to the edge of the chair, all the way to the edge, all the way to the edge. His heels should stay on the floor. If your heels come up when you are sitting at the edge of your chair, you have tight ankles and they need to be stretched out. It could be that one foot comes up before the other one does. And you might say to yourself, oh yeah, I remember when I was 12 and my brother pushed me off the bike and I twisted that ankle and it's never been the same since. Well, that's probably the ankle, the heel that's coming off the ground when you do this ankle flexibility test, right? So it all kind of makes sense that it ties in. Thank you, Matt. So obviously the answer to that is to stretch that calf out, and we can show you how to do that later. The other thing that we find people have a problem with is the muscles in front of their thighs are tight. If the muscles in the front of your thighs are tight, it's going to have a tendency to pull you forward like this. And again, when you're pulled forward like this, you can't interact with your environment. You're looking down at the road, and that can make you at risk for losing your balance. And probably that posture that I just had is very familiar. You've seen people like that before when they walk around like this. It can often be because their muscles in the front of their hips are tight. Why would the muscles in the front of your hips get tight? Well, if you think about what we do all day, not many of us stretch out the front part of our hips because we go from a sitting posture, right, where those hips are bent, right, and we're driving and we're on the computer and we're eating. So for 12 hours a day, we're here in a position where these front hip muscles can adaptively shorten and get tight. So then at the end of the day, we're like that because those muscles have shortened. Now, how else can this manifest itself? If you're a person that says, hey, you know what, I think the last time I laid on my stomach, it was 1968. That's another indicator that those front muscles are super, super tight, because if those muscles are tight, you're not going to want to be in a sleeping on your stomach position, because it's going to bother either your back or your hips. So that is something that you have to do to stretch out. Let's show you an easy way to stretch those out. Again, the only thing you need is actually two chairs. One chair here and one chair here. I'm going to use my friend Matt again to show you how to stretch out your hip muscles. He's going to face this chair. He's going to hold onto this chair for support. He is then going to bend forward. He's going to put his foot back on that chair. And then he's going to try to stand up. Now, understand that Matt is a young, healthy, flexible person, so he sure did make that easy. Some of you can't even get up to that position. Right there, you're like, ooh, boy, do I feel that in my thigh. That's okay. You might have to put that foot up on a stool rather than a chair. Maybe that's too high for you. But you can kind of see how this stretches out this part of his hip. And that's a good thing to do every day, because guess what? If you're sitting a lot, if you go from your lazy boy to your computer chair, to your dining room chair, to your car, you're never in this position. You stretch this hip out, it allows you to stand up taller, you can see your environment, and your balance magically improves. Thank you, Matt. So, those are a couple exercises that we often prescribe our patients, and it's an exercise that I think that you would enjoy if you used. So, we've gone over a lot. I hope that this is not information overload for you, but I've definitely given you some homework. And now I want to end this seminar with an offer. You might have more concerns, you might have more doubt in your mind about how to move forward. And what I want to do is I want to offer you a no-cost discovery visit in our practice to come in and speak to one of our doctors of physical therapy. 10-15 minutes, no cost obligation. We have a few spots open, and what you can do is once you come in, you can talk to the physical therapist about your specific issues, and we can discuss the results of your at-home tests. We can check you out a little bit and see what we think needs to be done and whether you're a candidate for even some more custom one-on-one care. So I hope that you'll take advantage of that. I have to tell you, it's a great offer to do that. I think that you kind of see what our logic is and our philosophy, which is really to treat the whole person to get you to return to the function that you may have lost over weeks, months, years. It does not have to be permanent, and a lot of these things can be reversed as long as you know what to do. So we are looking forward to hearing from you. Please reach out, click on the button down below, and get in for that no-cost discovery visit. Thank you very much for your time.